Thanks. And just thanks all for coming in at 9 o'clock on a Friday morning. We really appreciate it. The person, just to say, who's to give our talk, Sue, is actually at home sick with COVID. So we send greetings to Sue if she's tuning in. And yeah, so she's kindly lent us all her slides, which we've adapted a little bit to suit our way of trying to cope with the fact that she's not here. So I'm going to hand you over to Deirdre.
Good morning, everyone, and thank you very much, Susan. And my name is Deirdre Betts, and I am your college nurse here in the Blanchetown campus. So I will co-present here with my colleagues, Sinead and Susan. So really, why are we here today? We're here today because of World AIDS Day, and the agenda really is to make this the last decade of HIV. Now, some of you will be very familiar with what HIV is because you live with it, or your families live with it, or your friends live with it, and others will be less familiar. So from that perspective, we're going to take it as people aren't very familiar with it, just so that everybody is able to engage in the conversation. So what are we going to cover here today? So we're going to cover what is HIV, how it is transmitted, how it is prevented. We'll do a bit of myth busting around HIV. We'll talk about the free STI testing that we can access here in Ireland. We'll talk about how the medications and how much they've evolved around the prevention and treatment of HIV. And we'll talk about the U=U message. And I'll be handing over to Susan then, who'll talk about HIV in the global perspective. And Sinead then is going to take it up with the services available here in Ireland through HIV Ireland. So what does HIV stand for? Do you know what it stands for? So it's human immunodeficiency virus. So it's a virus that attacks the immune system, so rendering somebody immunocompromised. It can make them very, very ill. So it requires treatment and management for life, no more than epilepsy or diabetes. Treatment and management for life. Okay, how is it transmitted? So these are the way it's transmitted. So there's through the blood, through the semen, vaginal fluids, rectal secretions, and breast milk. All right, so we can prevent all of that. We can prevent all of that transmission. So in sex, it's through anal and vaginal or frontal sex, and that's with the condomless sex with a HIV person who is not on effective treatment. So if my partner is on effective HIV treatment, they cannot pass the HIV virus on to me. So this is the risk factor then, is if you are having sex without, so condomless sex with somebody who's not on the effective treatment. And also, if I know that my partner is HIV positive, I can take measures to prevent myself getting infected by taking this PrEP, pre-exposure prophylaxis. So if I don't take the PrEP and I know my partner's HIV positive, well, then I'm putting myself at risk of getting HIV. People ask about oral sex, very, very rare, very, very rare. So blood to blood, and again, you see this really amongst people who are sharing works really. So people who inject drugs, and so that's either the contaminated needles or the syringes, but there's also a kind of a myth out there that it's just people who inject heroin. It's not just people who inject heroin, it's people who inject anything and that they've reused the needle or the syringe or they've shared it. And that goes for steroids as well. And that affects an awful lot of young people who mightn't be aware of that, okay? We're lucky in Ireland where all our organ donations and blood transfusions are all screened for any kind of infections. So if you receive a blood transfusion, or if you're so lucky to receive an organ donation, well then that will be screened and there'll be no infection present in it. But in other countries, and Susan will mention that, other countries don't have that same ability to do that. So they've little or poor screening. So there is a risk then where blood transfusions would pass on the virus because there isn't the screening there. So we are very lucky here in Ireland. And I suppose the whole idea is that the whole world should be equal. And vertical transmission. So this is the mother to child transmission, and so that's in the womb during pregnancy, and that is if the mother has HIV and she's not on effective treatment. So the effective treatment is offered to everybody who's diagnosed as HIV positive. The treatment is there, it is available, and it's free to them. And like, we have great clinics here, and they're all very, very specialized, spread around the country to look after people. So the mother would be offered the treatment to prevent the transmission to the baby, but it can happen. So if she's not on effective treatment or she doesn't know she's HIV positive, it can be transmitted in the womb during the pregnancy, during the actual delivery stage, and during breastfeeding. So HIV positive mothers are asked to bottle feed. These are the myths, and you probably heard the myths, and people hear all kinds of stuff as to how you can get HIV, or in fact STIs. You know, you get it from a toilet seat. That's rubbish. You don't get it from a toilet seat. Okay, you get it from kissing somebody. So a partner's HIV positive, and I'm kissing him. Am I going to get HIV from him? I'm not. Okay, I'm not. So we really have to bust those myths, and you as people here today listening to this stuff, you know, when you hear it, you've got to challenge it as well and say, well, actually, that's not true. Okay, sharing your cutlery, plates, knives and forks. If you live in a family, I know sometimes we can't be bothered going to the cutlery drawer and picking out a new fork, so we just take the next person's fork and use it. You can't get HIV from doing that. All right. We said the toilet seats, swimming pools. No. Never been in a swimming pool. There's kids peeing in it and everything. Mosquito bites was another one that was out there, that you went to Africa and you got bitten by a mosquito and you were definitely going to get HIV. That is rubbish. Okay, so we've gone through the methods of transmission, and these are not them. So these are the false things, and we need to be aware of them, and we need to be able to challenge them and say, no, these are not facts. This is not factually correct. You need to stop spreading those myths and those rumors, because it's scaremongering and it's stigmatizing. And that's the whole thing about HIV, is people get stigmatized. You know, they're othered. They have the HIV. You know, this kind of, it's othering people and marginalizing them and making them less than. So HIV is a lifelong virus, and is a lifelong illness, no more than many other lifelong illnesses that we're all living with. So HIV in Ireland, so that's you know, just over 9,000 people since the end of 2018, since numbers have been gathered, and there's a possibility that's underestimated as well, because there's people walking around there who have no idea that they have HIV. And I just wanted to bring this to your attention. So if there was over 500 diagnoses in 2018, that's roughly 10 people a week. That's 10 people a week in Ireland, every single week of the year, who are getting a new diagnosis of HIV. Now, we saw how it's transmitted. So all of that can be prevented. So we can prevent those 10 people a week from getting HIV. And that's incredible. And that's the information that we need to be sharing and that we need to be knowing, is that it's absolutely preventable. And that, you know, the WHO really want to, that's one of the strategies, is to reduce HIV transmission. And this is another thing I want to bring your attention to. So there was always this myth that HIV was a gay man's disease. And again, there was the blaming and the shaming of gay men, that they, you know, that they weren't accepted and it wasn't right, and all, and so they got this disease. Again, rubbish and myths. Just over half of the acquired HIV, people who acquired HIV, were gay or bisexual or men having sex with men. Okay, but look at this: almost 1/3 of the new viruses were actually acquired through heterosexual sex. Why are we blaming gay people? You know, so it's challenging those myths again, and just getting the correct information, the factual information, and realizing as a heterosexual person, yes, you can get HIV. This is not a gay man's disease. This is everybody's disease. Anybody can get it. And we've seen the ways it's transmitted. So keep going back to the ways it's transmitted. And if you're at risk, you know, well, then it can be you. So yes, you can go on to the next one there. So we do have the tools to end HIV. So we know how it's transmitted, and we know that we have treatment that can prevent it, and we have treatment that if I am HIV positive, that I can stay well, and I can actually reduce my viral load to the stage where it's completely undetectable in my blood system. In my blood test, it'll be completely undetectable, and therefore I cannot transmit it to my partner. All right, and that's the U equals U message. So undetectable equals untransmissible. So if I'm HIV positive, I'm offered antiretrovirals. So I take my medications daily. I look after myself from a health point of view. You know, you really, really have to look after yourself. No more than all of us, we all have to look after ourselves. And I will go for my regular blood tests, and I will get my viral load right down to a stage where it's undetectable. And then if I have condomless sex with my partner, then I can't transmit it to my partner, because U equals U, undetectable equals untransmissible. So how do you know if you have HIV? Well, there's free HIV testing. So HIV Ireland are the leaders in the country, I suppose, here with regard to specialising in HIV, and there is free testing. And so they test for other things as well, but HIV is obviously their main issue. So it's free in Ireland in public health clinics and other community-based settings. So it's good to know that. I would ask all of you today after this to do look up hivireland.ie and look at the work they do, and they have loads of resources and fact sheets and stuff. They give free condoms and they have free clinics. They're great for information. Say Sue Carter was supposed to be here today from HIV Ireland to do this talk, and unfortunately she couldn't. So we're trying to hopefully do her talk justice, because the message is so important to get it out there. And you people in the positions that you are going to be in the community, you are the people who are going to be disseminating this information. You are the people who will be amongst people who are asking questions, or who are looking for information, who are looking for resources, and who also may be peddling false myths that you can go, well, actually, I know this. And then you can point people in the right direction, you know, so that's the good thing. At least you're not saying, and you're all wrong there now. You can say, look, actually, I was at a talk and this is the information we're given. And then this is the site that you can go on, and that's got all the correct factual information. So, you know, go look at it yourself and make that decision yourself about what, you know, what you want to believe or not. But that is the information. And it's, you know, it's evidence-based information. That's what anyone wants, is evidence-based information, isn't it? What I'm really interested in talking to you today about is SH24. Does anyone know what this is? Anyone know what it is? No? So SH24 is Sexual Health 24. So basically it is sexual health 24 hours a day. So sh24.ie. Again, everybody, please look that up, write it down, stick it in your phone, sh24.ie. And it's run by the HSC in Sláinte Care, and it is free STI testing in Ireland. All right, so free STI testing, it's online. So if I think I may have been exposed to something, I'm not too sure, but I'd like to know. I wonder, have I got chlamydia, syphilis, gonorrhea, you know, anything. I wonder what have I got, because I may have had no condomless sex with somebody and I just may have been exposed. So, or I may have had oral sex. A lot of people don't know that you can get STIs through oral sex. You can. You know, I do these talks with fourth years and they go, what? Yes, you can get STIs through oral sex. So to the next slide there. So it's actually free in these 9 counties. So it's kind of the Pale really. So Louth, Dublin, Meath, Kildare, Wicklow, isn't it? Cork, Kerry, and Monaghan and Cavan. So if you're over 17, because 17 is the age of consent in Ireland, I hope everyone knows that. If you're over 17 with an address in these counties, you can apply for free STI testing, okay? And this is what happens. You go online and you fill in a questionnaire online that's really about your sexual activity, so which is individual and unique and personal to you, okay? So my sexual activity is different to your sexual activity is different to your sexual activity, all right? So you're going to fill in that form about your sexual activity, and from that goes to like a guide clinic, genital urinary medicine clinic. So the experts there, they will decide what tests you need and they will send it out in the post for free to you. All right, so it'll come like that. So don't be worrying that the adults at home are going to go, what was that thing that says STI testing on the front of it? It doesn't, okay? It'll come like that. So it just looks like an ordinary Amazon envelope. And in it then there'll be whatever tests you need. So for HIV, HIV and syphilis, there'll be a blood test. So it's no more than like a diabetic prick in their finger, and you put the little things into the pot. There's also your urine, and did I bring the swabs in this? Oh, there's no swab. And then there's swabs as well. So there might be a throat swab, a vaginal swab, or an anal swab, depending on your sexual activity and depending on your risk factors. So you do those in the privacy of your own home in your own time. There's loads of information with it. There's a YouTube tutorial on it as well if you have any issues. Some people learn better by watching it on a screen. And then there's also a helpline, a 7-day-a-week helpline. So if you're doing it, you're thinking, there's not enough blood in the pot, there's supposed to be more blood in the pot, what'll I do? And you can ring the helpline, they're really, really good, okay? So basically what it would do is you're doing your home testing and then you're sending it off in your lovely green free post envelope, and you just pop that into the nearest letterbox, and 3 days later, because you'll have given your mobile phone number on the online assessment, they'll text you back the results. All right. So if everything is clear, that's great. And if it's not, that they'll direct you further on what to do then. So that's really, really good to know. sh24.ie, free to everybody. Okay. Spread the word. Okay. And if anyone needs any further information, you can come to me upstairs in the Cree and I can do demonstrations, or if the class would like a demonstration at any stage, I can bring all the stuff in and do a full demonstration with you if you'd like. So, yeah, so that's basically it. So there's the clinical support 7 days a week. next one there. So the U equals U, we've covered that, and that's a really important message for everyone today to understand. U equals U. So it cannot be sexually transmitted when a person living with HIV is on the effective treatment and they have an undetectable viral load. And again, if you go into hivireland.ie, there's so much information there, because today we're really skimming the surface of HIV because of the time constraints. But you know, at your own leisure, because it's a really interesting subject as well, and because this can affect anyone you know. It's really, really important that we educate ourselves as well, that that we're not peddling myths and we're not misunderstanding people and we're not stigmatizing people. So PrEP is pre-exposure prophylaxis. So that's what, if I'm HIV negative and I want to have sexual relations with my HIV positive partner, I'll go on PrEP. So it's before the sexual activity, it's pre-exposure. So I'll take the antiretroviral medication. I had to get tested first of all to be sure that I'm not HIV positive. All right, it's highly effective, and you take your Truvada every single day, and it keeps the level of the antiretroviral in your bloodstream, in the vaginal tract and in the rectum. So it's free, and it's 2 years old. It started in November 2019, and basically, if you are normally resident in Ireland, you can access it. So it's really, really good to know that that's there. So there's experts in the area. Again, that's not, you don't just rock up to your GP for PrEP. You know, there's a whole consultation involved in it, and people can access PrEP, and that's the most important thing. So there is a method there of preventing the transmission. I can prevent it if I know my partner is HIV or high risk. So, and then post-exposure. So this really is after the act. So if I feel I have been exposed to HIV, so maybe I've had condomless sex with somebody who is HIV positive, and I'm thinking, oh, I didn't realize that, or, you know, now I need to go and get treatment. And it's also for, as a healthcare worker, if I get a needle stick injury and I don't know the HIV status of the person, or I don't even know whose needle it was, well, then I need to go on the PEP, the post-exposure prophylaxis, and healthcare workers are forever going on this. You go on it for 28 days. So it prevents, sorry, go back there, Sinead, 1 second. It prevents the HIV from establishing itself in the bloodstream. You must get it within 72 hours. So if you ever feel you have been exposed, you must act really, really quickly. Okay, so there's no shame in going to the sexual health clinic, or if you need to after hours go to an A&E to get it. Not everybody who goes, who thinks they've been exposed, will get the post-exposure prophylaxis, because there's a whole like screening to it, and an assessment to make sure that you actually do need it as well. Okay, because it can kind of make you feel a bit sick as well. So within 72 hours, people, so within 3 days of your exposure, the sooner you go, the sooner you start taking the post-exposure prophylaxis. So if you have been exposed to HIV through either a needle stick injury or through condomless sex, or through any of the methods of transmission that we discussed, well, then you need to go and get the post-exposure, and it's very, very effective. All right, condoms are our best friends, because they're very, very effective at preventing HIV, and you can get them free. You can get them free everywhere. Sinead has heaps of condoms in her office. I have heaps of condoms in my office. Do you have condoms in your office? Oh, she's not condoms in her office.
I'll just direct you that way.
So there's free condoms here available on site. There's no judgment. We've lube, we've everything. So, but really there's no excuse for people not to be using condoms to keep themselves safe. All right, and that's the most important thing, that you know that condoms are available and how to use them properly. And again, I can do full condom demonstration for you, because people say, oh, I know how to do it. I've asked people this, and when they've come into me and said, I know how to do it, well, show me how to do it, and they haven't done it right. All right, so we can do condom demonstrations if you like. So there are my contact details, nurse.blanchetown@tu.ie, tu.dublin.ie. So if you want any further information, you can talk to Gail if you would like any specific stuff extra covered in that in more detail. And at any stage, we're quite happy to come back individually as a team, whatever way you'd like. We're available. We are a resource to you to use as you need. So with that, I'm going to pass you over to Susan, who's going to talk about HIV in the global perspective. Thank you very much.
Thanks, Deirdre. Okay, what I want you to do for a second now is, you're sitting in a third level institute, you're getting ready to go out and work with younger people, and you've just had a whistle-stop tour for the last 20 minutes about HIV. If you were in some countries in the world, this just would not be happening. This wouldn't even be up for discussion. For the women in the group, you may not even be at third level. There might even be a third level institute. So one of the things we have is education, that possibility of education to keep ourselves safe. Sorry, to keep ourselves safe, to be well, and you also have that ability to share that information. For a lot of people around the world, I suppose HIV is nearly like the first step towards their death sentence. It's treatable here, and we're actually really, really privileged. But a lot of people, as I said, just don't have that sort of access. Just a couple of statistics. The UN AIDS, I suppose they're working really to try and eradicate AIDS within the next 10 years before 2030. So it's one of the leading public health challenges. Now we have COVID as well, and there is, we'll talk a little bit about the impact of COVID on the treatment around HIV. But 37.7 million people in the world, okay, are living with HIV at the end of last year. 1.5 million diagnosed last year alone. So the rate of, I suppose, acquisition, it is declining, but I suppose maybe a couple of years ago, it was going down quicker than it is now. So that's a reality for people. It's slowed down, and you have to kind of, well, why is that maybe? Okay. Why has the pace of the decrease slowed down in itself? Now, there is a difficulty in some countries of people accessing maybe information or treatment, and that's because of stigma. They don't maybe have access to the treatments that Deirdre was talking about. They're just not available, so they just don't even know that they have it. And then they can't afford the medication, or they don't have access to the medication. So some of the actions, we might talk a little bit more about these, but some of the actions that, I suppose we're beginning to be encouraged to take is to use governments to maybe raise awareness that it's not really acceptable. Like, why is there such inequality around the world? Why do, let's say, us have so much access and people in the world have no access? There are international policymakers, the UN, there's all sorts of government agencies that work across the globe. So how can you use your voice now that you're educated and will continue hopefully to be educated to influence policy? It starts locally and then maybe works up. And then to look at the economic systems. Like, we can learn an awful lot even from what's happening around the COVID vaccines. Who has access to them? Who has free access to them? Who has none? Like, we have the opportunity in this country to have our third vaccine. Some people even haven't had one yet. So maybe again, it's to look at, there's a kind of whole new movement around people vaccine, I think it's called. Again, something that you can look up, because it's around, vaccine justice. It's important to keep yourself informed, not just about your own health, as Deirdre has covered, but just what's happening around the world, because this impacts people's lives hugely. Use your voice as much as you can. It's amazing how much one voice can make a difference. And the other thing I didn't put it on this one, but I was just thinking about it last night was, we're in a very globalized world, and you'll be traveling, but even in terms of just keeping yourself safe, if you're traveling, and maybe, young people love to travel, but maybe if you're engaging in sexual activity and so forth overseas, remember, there mightn't be that same level of education, safety, medication with other people that you might meet. So that's just for your own personal well-being as well. Okay. So one of the big things that prevents people from maybe accessing treatment is stigma. People are rejected in their personal relationships and also by their community. When I was going around the other day on Wednesday, giving out ribbons on Wednesday morning, I was actually amazed at how many people didn't even know what AIDS was, or what the relation was with HIV, or that it was even an issue. And that maybe shows how much we've advanced in this part of the world. But a few years ago, I was in South Africa, and like, there was a hospice there, which we visited, and that was for people just dying because of HIV and AIDS. It was its sole purpose, because the people weren't allowed to go into any other type of care for end-of-life care. And then we also visited, we sent volunteers to work in an orphanage, and most of the children were there because they had been orphaned as a result of the parents passing away because of AIDS. So it's still a real problem in countries in the world. There is that kind of still that sense in some parts that living with HIV is shameful. For my work in homeless services, though, I've experienced quite the opposite, in that if you're maybe engaging with somebody in a chat, or you have to maybe give them a bit of extra support, people in Ireland are maybe a little bit freer at some points to just say what their status is. And once they feel that that's a safe space to share that and they're respected, it's fine. but in other communities across the world, you can't mention it because you'd be absolutely shunned. And that they don't want to associate with you because of that stigma. But the other thing to remember is that it's not just an individual who's affected by HIV and AIDS. Yes, there's that psychological kind of impact upon the person. They can feel absolutely rejected and isolated and ashamed because of the stigma that's put on them. In that stigma can prevent people accessing healthcare, but in some countries that healthcare isn't even there for them to access. Then the person, as Deirdre said, person's immunity is compromised. So they're open then to pick up other infections much, much more quickly. So they become, I suppose, more disabled, more dependent on other people over time. And that can have a huge impact then on, say, families. Go to the next one. Thanks, yeah. All right, so one of the things is that a family may not have known maybe some of the behaviors or so forth of what other people in their family might have been engaged in. So that's the first thing that they might maybe have, if it was something that was transmitted through, say homosexual activity or whatever, they might suddenly, oh, okay, we didn't know that. And now it's suddenly become a family issue. And in some countries, of course, that's nearly, it's so homophobic that it's just actually nearly, they just can't cope with it, I suppose. People can be shunned by the family as a unit, because there's that fear around still how it's transmitted. So the family can be shunned by the village, by the community. Children can be isolated as a result of it. But then you have that impact where you may have, in some countries where I suppose they have a lot of children to care for older as they get older because they don't have the healthcare systems that we have, then you have the parents suddenly caring for adult children who are getting really, really sick. Or you may have young children caring for their parents who are getting sick. So it has a huge impact upon the family. And the other part of that then is on the economics of family life. So if somebody was earning some sort of income, they won't be perhaps well enough to go and keep working. So the family is down that income. And then there's the cost of treatment, if they can get it, that they have to pay for. So we also can take our social welfare system and that provision like of the PUP payments during COVID lockdown. Other countries didn't have that at all. You know, in some countries, people were just sent home from work with nothing. So, you know, it's to think about those other factors around something that we don't even nearly talk about that much anymore. Okay, so the theme, I suppose, around the World AIDS Day, which we were asked to kind of share with you, was to end inequalities, end AIDS, and end pandemics, including COVID. So it's the first image there. It just says, because the print might be a bit small, is no one is safe until we're all safe. And we're probably a little bit aware of that now at the moment because we're living in a different pandemic. But the more people can try and keep safe, the less the opportunity there is to transmit diseases of all sorts. Women still experience, I suppose, the greatest impact in relation to HIV. And they would still globally experience a lot more violence and sexual violence. And I suppose even over, we'll come back to it in a few minutes, but even over the pandemic, the COVID pandemic, the incidences would have increased, and including maybe the transmission of HIV. Okay, there is the information, there is the technology, there is the science there, but we have to kind of globally work together to try and share that equally so everybody can benefit. And it's all about working in solidarity. And we're not maybe that good as an international community at really working in solidarity. It's kind of one country sometimes against the other, maybe driven by economics. To work, we need to use our voice to work that everybody has that access to equal healthcare, because otherwise nothing is going to change, because if one country is suffering, it's going to impact upon others. The next one. Okay, just in case you're doing other aspects around sustainable development goals, this fits in under the number 3, the sustainable goal number 3, and it's about public health and increasing public health by 2030. Okay. That's it, zero new HIV infections, 0 AIDS-related deaths, and 0 stigma and discrimination. So that's the UN AIDS goal as well, to try and work towards that. We're going to skip that one because there's not a lot of information in this one now. I know you're not superhuman, you can't read that. But this is really just kind of looking at the impact that COVID has had on, I suppose, the education and the treatment of HIV around the world, and even in Ireland, because what would have happened, of course, is, as I said earlier, people's immune system is compromised. So, of course, they're much, much more vulnerable to even contracting the COVID. Then a lot of the services that people who need, that are needed by people who are experiencing HIV, they were all closed down. Access to clinics would have been changed. People couldn't travel. And then if you were restricted to a particular county and you needed to get somewhere else. So, you know, it made life very difficult here. So you can imagine in other countries, even probably medication didn't even get to some countries to even treat HIV. The print is so small that I can't even read it. We've just talked about the level of violence in a lot of homes did increase during the pandemic. And that would be true just across the world. So that's where women would have been perhaps much more vulnerable now to contracting HIV. And then there was a stigmatization then of people who are maybe HIV positive in some communities as also being totally responsible for the transmission of COVID. So they were nearly doubly stigmatized, especially at the beginning of the pandemic. So yeah, because your immune system is compromised, you picked up the COVID and then you've passed it on much more quickly. And then of course we have the economic effects that COVID has had, I suppose, impacting the lives of people with HIV and just bringing them back into a place of absolute poverty. Okay, then we're going to pass over to Sinead. Thank you.
Thank you very much, Susan. So I'm just going to tell you a little bit about the services that are available to students and all. Thank you very much. I thought I was loud enough as it is, but anyway. Yeah, so these are the services that are available to use as students and also to anyone who might be living with HIV or AIDS. So if you're living with HIV or AIDS, there is peer support and there is support and advocacy. And there's also as like education and training. So this is one example of the kind of education and training around HIV and AIDS. There is free HIV and STI testing, as our nurse Deirdre spoke to you about earlier. There is the Empower program, which is kind of a campaign around empowering people, especially men and young men, to kind of get tested and get their sexual health tested and that kind of a thing. And there's free counselling for anyone who might be living with AIDS or HIV or supporting someone with HIV or AIDS or impacted by that. There's also free counselling available to students as well. All you have to do is send their counsellor an email. There's free condoms available to all you people as students. You can get them from either my office, you can get it from Deirdre's office. We're both located upstairs in the C block. And there's no judgment or anything like that. Just come and get them. People knock and ask for them all the time, so it's just second nature to us at this stage to hand them out. There's also free HIV self-test kits. So as Deirdre showed you the example of that test kit, and there's videos online, as Deirdre had said, and given demonstrations on how to do them. There's one of our officers as well in the union actually did a video of him doing a demonstration of one of the test kits. So if you want to see that, that's on our Instagram. There is free educational resources around HIV and AIDS and also around, all types of different sexually transmitted diseases and that kind of a thing. We also have a couple of little resources here if you want to come up at the end of the class and take some of them and just have a look. There's lots of different policies that have been developed around HIV and AIDS, and there's also a lot of research that has gone into this disease. It's been around for a long time now. Things are kind of changing around the HIV and AIDS thing. Like, I would be aware of HIV and AIDS, but I know other people my age have never even heard of it, which is really interesting, because then there's people like Deirdre and Susan, and they would have said that when they were younger it was kind of a hot topic, and nowadays it's not really something that's talked about as much. And then there are different campaigns and events in relation to HIV and AIDS, and you can go onto the HIV Ireland website and find out a little bit more about that. Am I playing this? No. Yeah, so one of the events that's coming up, it's actually this Saturday, and it's a World AIDS Day run. And you can go on the website and it'll tell you, if you want to sign up for that and have a go at that. It's a good way of raising money and that kind of a thing for the charity. And then there is, well, that's today at 1 o'clock, so might be a little bit late on that one.
It's Saturday, isn't it?
No, the HIV and AIDS webinar.
Today one, yeah.
Yeah, so then if you want to kind of donate to HIV Ireland, you go onto their website, or you could do a fundraiser for them. And then there's a couple of dates there around different events, awareness raising days and that kind of a thing. And they're different, national days. So there's Irish AIDS Day, which is the 15th of June, World AIDS Day, which is the 1st of December, which is this week, which is why we're doing this talk, and the 1st of March, which is Zero Discrimination Day. And then these are just a couple of the takeaway messages from today. So just to reiterate everything the two ladies have said, that HIV is treatable, and it's a chronic condition, and also that PrEP and PEP prevent HIV. HIV cannot be passed on through sex when a person who's living with HIV is on effective treatment. And that basically the whole aim of this is to, reduce the stigma, end the stigma, end the inequalities, which will eventually in turn hopefully end HIV, and U equals U again, undetectable equals untransmissible. So if anyone has any questions, you can feel free to ask. Either Deirdre or Susan or even maybe Gail or myself might be able to answer them. And just to say, do you have a question?
Symptoms. Yeah, you could actually live in but there is a certain version from being HIV negative to HIV positive, and during that period, some people may become ill, and feel like symptoms, or they lose a lot of weight, or just get really, really ill, and then so there's no one carrot symptom or anything like that. I suppose the most important thing is that you know how it's transmitted and you know people exposed. So that's really important to know. So if you get exposed, but then you can the post exposure. The whole thing is going back to trying to prevent getting, becoming HIV positive. So if anyone thinks that they have been exposed in the life test, you can get tested through that. That's the HIV test through that SH24 testing or through HIV Ireland. Most important is to know then that's it. You can completely suppress that virus in your body and go around your business, and you can't give it to your partner, you can't give it to anybody else, and you just have to take medication. Also, there the expertise there. You can't handle this. Anyone who's concerned today that anything and use okay, this is a win-win situation. Because if you do test something negative, isn't that great? And now we know how it's transmitted. You can prevent yourself from being in that situation. Okay? And then if it is positive, you can try to start treatment because the viral load will be very, very high, and you start taking the treatment and it gets down. It probably take maybe nearly up to, it's a good 6 months, up to a year to get right down. But during that period, you're being looked after and it's not going back up. Or all this there. So that's the most important message. If you think it is, go get tested. If you're negative, it's great. You're going forward, that you're negative. You're going to take the precaution. And positive and the positive, you're going to treat negative virus like that.
Anyone else got any questions?
One thing I would say myself is whatever our sexual orientation, we need to be aware and another aspect for me is very important because I work with with people who are living with addiction. We need to reduce the stigma. Stigma is a big issue. So, and I'm talking here not only to individuals, I'm talking here as future youth workers and community workers. And what Deirdre and Susan said, and Michelle said as well, is very important for you professionally. You have a role to play in preventing, by providing information, by empowering communities. And that's part of the future role of that profession.
Absolutely. Just to add to that point, it's very relevant to you guys here today because I actually did your course and I recently graduated, and I was working in an addiction setting then afterwards. And you do come into, you may, not definitely, but you may come into contact with people who do have a diagnosis of HIV or AIDS. you know, and you do kind of want to support them and that kind of a thing. So it's really, really relevant.
And can I just say, like, I've worked in prison for 13 years, and this is how stigma works. Oh, sorry, I beg your pardon, sorry. I worked in prison for 13 years, and this is how stigma works. I've had people who are HIV positive who would not tell us that they were HIV positive because they did not want to have to come to the nurse to get their medication and everyone else to know that they were coming to get medication. And they didn't want anyone else in their cell to know that they were HIV positive. So they actually went without medication, allowing the viral load to go high because of the fear of the judgment and the stigma that we impose on people, because we judge HIV to be, you know, not a nice disease or a good disease, or we, you know, like, it's all about inclusion. You know, everyone has something. We have something. We have, you know, something a little different about us, and that's okay. And that's, you know, thank God we're all different. But we can't judge people because of an illness, and we can't blame people. It's victim blaming and victim shaming. You know, so like that's just it. So it's really important that you know, as you go forward in your workplace, that you're very, very clear about that it's not our place to judge or to blame. It's none of our business. We're there to support. You know, and that could be us too. Okay, that could be us. If you haven't been tested, you don't know your status. That's really it. So know your status, get checked.
Thank you so much.
Thank you.
Thank you very much, Gail, for giving us your time, your class time, and for all of you for coming in so early on a Friday morning, and for your attention. And you know, we'll come around if you want to ask questions later on, and just to pick up the bits and pieces there if you want, because you're going to be the educators, as Gail said, when you're there, and just keep that global awareness part as well. Thanks very much. And thanks, Suzanne, for coming in to connect us with the rest of the people. Thank you.